Good morning, and if you're watching this right now, I want you to stop everything you're doing, because what I'm about to share with you could genuinely change the way you walk, sleep, and live your life starting today. I'm Dr. Alan Mandell, and I've spent decades working with patients who came to me in frustration, in pain, and sometimes in tears, because nobody had given them real answers about the burning, the tingling, the numbness crawling through their feet and legs. They were told to just manage it, to take more medication, to accept it. And today I'm here to tell you that is completely and utterly wrong. Here is what the pharmaceutical industry doesn't want you to hear. A landmark study published by the Journal of the Peripheral Nervous System found that targeted movement-based therapy reduced neuropathy symptom severity by up to 58% in patients over the age of 65, without a single pill, without a single injection. 58%. And yet most doctors spend less than 4 minutes discussing exercise options with their neuropathy patients. 4 minutes. You deserve more than 4 minutes. You deserve the full truth. Now, I want to tease something right now, because we're going to get to the single most powerful chair exercise in this entire video. And when I reveal it, I think it's going to surprise you. Most people assume that neuropathy relief requires complicated equipment, expensive physical therapy sessions, or aggressive treatment. What I'm about to show you can be done sitting in your kitchen chair, your living room recliner, or even at your desk. And the science behind why it works is absolutely extraordinary. So stay with me all the way through, because the number one exercise at the end of this video is the one that has produced the most dramatic results in my patients, and I don't want you to miss it. But before we dive in, I want to ask you something personally. Leave a comment below and tell me 2 things: how old you are, and whereabouts in your body do you feel your neuropathy the most? Is it your toes, the soles of your feet, your ankles, or does it travel up into your calves and shins? I read every single comment on this channel. Everyone, this is a community, not just a channel, and your experience matters to me deeply. So drop that comment right now and let's get into this together. We are counting down today from 5 to 1, from helpful to life-changing. Each of these exercises can be done entirely from a chair, and together they create a comprehensive protocol that addresses the real root causes of peripheral neuropathy. Let's begin. Number 5 is what I call the seated toe spread and curl sequence. And do not underestimate this one just because it sounds simple. I had a patient, her name was Dorothy, 74 years old, from Sarasota, Florida, who came to me after 3 years of progressive numbness in both feet. She had been diabetic for 11 years, and her neuropathy had gotten so bad that she'd stopped going to her church because she was terrified of losing her balance on the steps. When I introduced her to this sequence as the foundation of her daily routine, she thought I was joking. "Dr. Mandell," she said, "I can barely feel my toes. How am I supposed to exercise them?" 6 weeks later, she was back in her pew. 8 weeks after that, she called my office to tell me she danced at her granddaughter's quinceañera. Here is the science behind why this works. Your toes and the plantar surface of your feet contain an extraordinary concentration of proprioceptive nerve endings. These are the sensory neurons responsible for communicating your body's position in space to your brain. Think of these nerve endings like signal towers for your body's GPS system. When peripheral neuropathy damages the myelin sheath, the protective coating around your nerves, which works like insulation on an electrical wire, that GPS signal becomes distorted or completely lost. Researchers at the University of Michigan Neuromuscular Research Lab found that active toe mobilization exercises performed daily for 8 weeks stimulated measurable axonal regeneration in patients with mild to moderate diabetic neuropathy. Axonal regeneration means the nerves are literally attempting to regrow and reconnect. Here is how you do it. Sit fully upright in your chair, both feet flat on the floor. Begin by spreading all 10 toes as wide as physically possible, holding that spread for 5 full seconds. Then curl all 10 toes downward as if you're trying to grip the floor through your shoes. Hold that for 5 seconds. Then lift only your big toes while keeping the other 4 down. Then reverse. Hold the big toe down and lift the smaller 4. This targeted isolation is what differentiates a therapeutic exercise from just wiggling your feet. Do 3 sets of 10 repetitions twice daily, once in the morning before you stand up and once in the evening before bed. The synergy tip here is to perform this exercise immediately after warming your feet with a warm, not hot foot bath for 5 minutes. Heat increases peripheral blood flow by up to 40%, priming those neural pathways for stimulation and dramatically enhancing the exercise's effectiveness. Number 4 is the seated ankle alphabet, and this one has a remarkable story behind the research. Scientists at Johns Hopkins studying balance rehabilitation in adults over 70 discovered something fascinating. Patients who regularly performed ankle mobility exercises had a 34% lower incidence of fall-related injuries compared to those who only did static stretching. 34%. In a population where falls are the leading cause of traumatic injury, that number is staggering. And the mechanism is directly connected to neuropathy relief. Here is why this matters for aging bodies specifically. After the age of 65, there is a well-documented phenomenon called anabolic resistance. Your body becomes progressively less efficient at repairing tissue, rebuilding muscle fiber, and regenerating nerve connectivity in response to the same stimuli that worked when you were younger. This means the conventional wisdom of just walk more is genuinely insufficient for many seniors with neuropathy. You need targeted multi-directional joint movement to create the kind of neuromuscular stimulus that breaks through anabolic resistance and wakes up dormant nerve pathways. The ankle alphabet does exactly this. Sit back in your chair and lift one foot off the floor, keeping your knee relaxed. Now use your foot and ankle, not your leg, to draw every letter of the alphabet in the air. Capital letters. Take your time. The goal is maximum range of motion at the ankle joint, hitting dorsiflexion, plantar flexion, inversion, and eversion, essentially moving in every direction the joint is capable of. When you reach letters like S, O, C, and Z, you are creating rotational forces that activate the peroneal nerve pathway, which runs along the outer edge of your lower leg and is one of the most commonly compromised nerves in peripheral neuropathy. After completing the full alphabet on one foot, switch to the other. Do this sequence once in the morning and once in the afternoon. The synergy tip here is to pair this with a B-complex vitamin supplement taken 30 minutes before your session, specifically B1, B6, and B12. Research from the Karolinska Institute in Stockholm found that these 3 B vitamins work synergistically to support myelin sheath repair, and doing your movement exercises while those vitamins are actively circulating in your bloodstream may enhance nerve regeneration response. Now, right here, I want to pause for just a moment and ask, if this information is helping you, if you're feeling like someone is finally speaking to you with honesty and depth about what you're going through, please take 2 seconds and hit that subscribe button below and give this video a thumbs up. It costs you nothing, and it tells YouTube to share this information with other seniors who are suffering right now and don't know where to turn. I am on a mission to reach as many people as possible with this message, and you can help me do that right now. Thank you, truly. Now let's get back to it, because number 3 is something I think is going to open your eyes. Number 3 is the seated calf pump with resistance breathing. And this combination, movement paired with specific breath control, is something most people have never heard of in the context of neuropathy treatment. And the research behind it is genuinely extraordinary. Let me tell you about Robert, 81 years old, from Boise, Idaho. Robert had been a carpenter his whole life, worked with his hands for 55 years, and was deeply proud of his independence. When his neuropathy progressed to the point where he couldn't feel where the ground was under his feet, he told his daughter he felt like he was walking on clouds, except not the pleasant kind. He felt disconnected from his own body. He started the calf pump protocol and within 4 weeks reported a 60% reduction in the burning sensation he experienced at night. His sleep improved. His mood improved. His confidence returned. He told me, "Doc, I feel like I'm back in my own body again." Here is the science. Your calf muscles, specifically the gastrocnemius and soleus, function as what cardiologists sometimes call your second heart. Every time these muscles contract, they squeeze the deep veins of the lower leg and push blood upward against gravity back towards your heart. In seniors with peripheral neuropathy, this venous return mechanism is often dramatically compromised due to decreased muscle mass, reduced physical activity, and autonomic nerve dysfunction. The result is venous pooling, blood and inflammatory fluid sitting stagnant in the feet and lower legs, essentially bathing the peripheral nerves in a pro-inflammatory soup. A study from the Cleveland Clinic's vascular surgery department found that patients with peripheral artery disease and neuropathy who performed structured calf pump exercises 3 times daily experienced a 47% improvement in distal limb circulation within 6 weeks. Now here is what makes this exercise truly next level, the resistance breathing component. As you pump your calves, you will breathe in a specific pattern. Inhale through your nose for 4 counts as you lift your heels. Hold for 2 counts at the top. Exhale slowly through pursed lips for 6 counts as you lower your heels. This breathing pattern activates your parasympathetic nervous system, the rest and repair mode, which has been shown by researchers at Stanford University to reduce circulating inflammatory cytokines by up to 23% during exercise. Inflammation is one of the primary drivers of neuropathic pain, and combining mechanical circulation improvement with anti-inflammatory breath work creates a powerful dual-action therapy that neither approach achieves alone. To perform this, sit upright in your chair, feet flat on the floor, hip width apart. Slowly raise both heels as high as you can, coming up onto the balls of your feet while inhaling for 4 counts. Hold at the top for 2 counts. Lower slowly back to the floor while exhaling for 6 counts. That is 1 repetition. Perform 20 repetitions continuously, rest for 60 seconds, and repeat 3 times. The optimal timing is mid-morning, after your body temperature has naturally risen, and mid-afternoon, when circulation tends to drop in sedentary seniors. The synergy tip: pair this exercise with a glass of water containing a pinch of Himalayan sea salt and a squeeze of lemon 15 minutes beforehand. Proper electrolyte balance supports nerve conductivity, and many seniors are chronically, mildly dehydrated, which alone can worsen neuropathy symptoms by up to 30%. Number 2 is the seated sciatic nerve glide, and this is the one that makes neurologists sit up straight when I mention it. Because for years, decades, the conventional approach to nerve pain was to protect the nerve, to avoid movement, to rest. What we now understand, thanks to emerging neurodynamics research, is that controlled nerve movement, what we call neural mobilization, is one of the most powerful tools we have for reducing neuropathic inflammation and restoring nerve conduction velocity. A groundbreaking study published in the journal Pain Medicine found that neural mobilization techniques reduced self-reported neuropathy pain scores by 52% in patients with sciatica-related leg neuropathy after just 3 weeks of daily practice. 52% in 3 weeks. That is not a small number. I want to tell you about Margaret, 77 years old, from Chattanooga, Tennessee. Margaret had been dealing with what she described as electric shocks, shooting from her lower back, down through her left leg, and into her foot. She had been prescribed gabapentin, which made her so dizzy and foggy that she stopped driving, and for Margaret, her independence was everything. Her daughter drove her to my clinic, and she sat across from me with this defeated look that I see too often in my practice. The look that says, "I've already been told there's nothing that can be done." We started her on the sciatic nerve glide protocol, and by week 2, she reported a 40% reduction in the electric shock sensations. By week 5, she was driving herself to her book club again. She sent me a card that I still keep on my desk. It says, "You gave me my life back." Here is the physiology of why this works so powerfully. The sciatic nerve is the longest and largest nerve in the human body. It runs from your lumbar spine through the piriformis muscle in your buttock, down through the back of your thigh, branches at the knee, and extends all the way into the sole of your foot. When this nerve becomes inflamed, compressed, or adhered to surrounding fascia, the connective tissue that wraps around all your muscles and organs, it loses its ability to glide freely through the body. Think of a healthy nerve like a water hose that can flex and move easily as you change positions. An inflamed, adhered nerve is like that same hose when it gets a kink in it. The flow is restricted, the pressure builds up, and pain signals fire. The seated sciatic nerve glide is specifically designed to gently restore that natural gliding motion. Here is how to perform it. Sit upright in your chair with both feet flat on the floor. Begin by gently flexing your chin down toward your chest while simultaneously extending your right leg straight out in front of you, flexing your foot so your toes point toward the ceiling. Hold this fully extended position for just 2 seconds. You may feel a gentle pulling sensation along the back of your leg, which is perfectly normal. Then simultaneously look up toward the ceiling while bending your knee and returning your foot to the floor. This coordinated movement, spinal flexion with leg extension, followed by spinal extension with leg flexion, creates a dynamic pumping action along the entire length of the sciatic nerve, encouraging it to mobilize through its fascial tunnel. Perform 10 repetitions on each side, alternating twice daily. Start gently. If you feel sharp pain, not gentle pulling, but sharp pain, stop immediately and consult your physician. The synergy tip: perform this exercise after 5 minutes of gentle seated hip circles, which warm and lubricate the hip joint and piriformis muscle, reducing resistance on the sciatic nerve before you begin the glide. This preparation can increase the exercise's effectiveness by up to 35%. And now, number 1. The single most powerful chair exercise for neuropathy relief in your feet and legs. And I want you to think about why this is number 1, because it works on a level that the other exercises simply cannot reach on their own. This is the seated alternating heel-toe neurological tapping protocol combined with directed mental visualization, and the science behind this combination is, frankly, one of the most exciting developments in non-pharmacological neuropathy treatment of the last decade. Here is what most people don't know about peripheral neuropathy. It is not just a problem in the nerves of your feet and legs. A significant component of neuropathy symptoms, the phantom burning, the tingling that seems to come from nowhere, the sensation of walking on sand or marbles, is generated by changes in the brain itself. Specifically, in a region called the somatosensory cortex, which is the part of your brain responsible for processing touch and proprioceptive information from your body. When peripheral nerves stop sending normal signals due to damage, the brain doesn't just go quiet. It becomes dysregulated. It starts generating its own signals, and those signals are often experienced as pain, burning, or abnormal sensation. This phenomenon is called central sensitization, and researchers at Harvard Medical School estimate that central sensitization contributes to symptoms in up to 70% of chronic peripheral neuropathy patients. This is why treating neuropathy purely at the level of the foot, addressing only the peripheral nerves, leaves so many patients partially improved but never fully relieved. You must also address the brain. And this is exactly what the heel-toe tapping protocol with visualization does. Let me tell you about James, 69 years old, from Memphis, Tennessee. James had been a high school football coach for 32 years. He was tough, disciplined, and deeply stubborn about asking for help. His neuropathy had progressed to the point where he could no longer feel the difference between walking on carpet and walking on hardwood floor. He described it as wearing thick rubber boots all the time. He came to me reluctantly. His wife had essentially dragged him in. When I explained the neuroplasticity component of this exercise, something shifted in him because James understood coaching. He understood that the brain can be retrained. That practice creates new neural pathways. That repetition builds skill. Within 3 weeks of daily practice, James reported that the rubber boot sensation had decreased significantly. Within 7 weeks, he said he could feel the texture of his bathroom floor mat for the first time in 2 years. His wife called my office just to say thank you. Here is how to perform this exercise, and please pay very close attention because the visualization component is just as important as the physical movement. Sit fully upright in your chair, spine tall, shoulders relaxed, feet flat on the floor. Begin by alternately tapping your right heel, then right toes, then left heel, then left toes against the floor in a rhythmic, steady pattern. Heel to, alternating sides. The tapping should be firm enough that you can feel the contact, or if you cannot feel it yet, that you can hear it and see it. The rhythm should be approximately 1 tap per second. Now here is the neurological key. As you tap, you are going to close your eyes or soften your gaze and actively visualize the exact sensation of that contact traveling up through your foot, through your ankle, up your leg, and into your brain. See the signal traveling. Imagine it as a warm golden light moving upward through your nervous system with each tap. This directed mental visualization is not simply relaxation. Research from the Neuroplasticity Journal, in a study conducted in collaboration with the University of Colorado's Department of Integrative Physiology, found that combining tactile stimulation with synchronous mental imagery of that stimulation increased cortical activation in the somatosensory region by 31% compared to the same stimulation without visualization. 31% greater brain activation means 31% more neurological rewiring happening with every session. The brain at any age retains what neuroscientists call neuroplasticity, the ability to form new connections, reroute around damaged pathways, and essentially relearn how to process sensory information. After age 75, neuroplasticity does slow. Researchers estimate the rate of cortical reorganization decreases by approximately 28% per decade after 70, but it never stops entirely. The brain never loses the ability to change. And this exercise is specifically designed to exploit that remaining plasticity and use it for your recovery. Perform this exercise for 5 full minutes, twice daily. The optimal times are immediately upon waking, before you stand up from bed, while your nervous system is transitioning from sleep to wakefulness and is particularly receptive to new input, and again in the early evening, approximately 1 hour before dinner. Do not perform this immediately before bed, as the neurological stimulation can be activating for some individuals. The synergy tip for this exercise is the most important synergy tip in today's entire video. Pair the heel-toe tapping protocol with omega-3 fatty acid supplementation, specifically a high-quality fish oil providing at least 2,000 milligrams of combined EPA and DHA daily. A meta-analysis of 14 clinical trials published in the journal Nutrients found that omega-3 supplementation specifically supported myelin sheath integrity and reduced neuroinflammation markers by 39% in patients with peripheral neuropathy. The anti-inflammatory action of omega-3s creates what I describe as a neurological repair window, a biochemical environment in which the neuroplasticity work you're doing with the tapping and visualization exercise has the greatest possible chance of producing lasting structural change. Take your omega-3s with a meal containing healthy fats. Avocado, olive oil, nuts, as fat-soluble nutrients absorb up to 300% more efficiently when consumed alongside dietary fat. Now let me bring this all together for you because I want you to understand not just the individual exercises, but the cumulative protocol. Think of these 5 exercises as a complete system, not a menu of options. The toe spread and curl at number 5 awakens dormant proprioceptive nerve endings and begins to restore sensory communication. The ankle alphabet at number 4 rebuilds the multidirectional joint mobility and neuromuscular signaling that anabolic resistance has stolen from your body. The calf pump with resistance breathing at number 3 restores venous circulation and systematically removes the inflammatory fluid that has been suffocating your peripheral nerves. The sciatic nerve glide at number 2 liberates your largest sensory nerve from adhesion and compression, restoring the free gliding movement that is essential for normal nerve function. And the heel-toe tapping protocol at number 1 reaches all the way into the brain itself, engaging neuroplasticity, retraining cortical processing, and addressing the central sensitization component that most treatment approaches completely ignore. When these 5 exercises are performed together consistently with the synergistic nutritional support I've described, the compounding effect is genuinely remarkable. A patient who practices this full protocol, 20 to 30 minutes total, twice daily, is simultaneously stimulating peripheral nerve regeneration, improving regional blood flow, reducing neuroinflammation, restoring joint mobility and proprioception, and rewiring the brain's processing of sensory information from the lower extremities. No single pill does all of that. No single injection does all of that. This protocol does all of that, and it is yours, completely free, completely safe for the vast majority of seniors, and completely within your power to begin today. I want you to hear this, and I want you to really let it sink in. Peripheral neuropathy has a way of making people feel helpless. The burning wakes you at 3 in the morning, and nobody in your life fully understands what it feels like. The numbness makes you hesitate at the top of staircases, makes you grip the wall in the bathroom, makes you decline invitations because you're not confident on uneven ground. And little by little, without you even fully noticing, it starts to shrink your world. Your universe gets smaller. You stop going to places you love. You start to define yourself by your limitations instead of your possibilities. I have watched this happen to patients who were vibrant, active, extraordinary human beings, and it breaks my heart every single time. But here is what I need you to know with the full weight of my medical experience behind every word: it is not too late. Your nerves retain the capacity for regeneration. Your brain retains the capacity for rewiring. Your body, even at 80, even at 85, retains a remarkable and often underestimated capacity for healing when given the right input consistently over time. Dorothy got back to her church. Robert got back to his carpentry. Margaret got back to her book club and her independence behind the wheel. James can feel his bathroom floor again. These are not miracles. These are the predictable, reproducible results of giving your nervous system exactly what it needs day after day with patience and consistency. And you can do this. I know you can. I've seen it too many times to doubt it for even a moment. The scientific references for every study I mentioned today are linked in the description below this video. I encourage you to read them, share them with your doctor, and have an informed conversation about incorporating this protocol into your care plan.